Pulsus paradoxus is an exaggeration of the normal inspiratory fall in systolic blood pressure. This is inspiration, this is expiration, respiratory tracing. You can see that in expiration the pressure is more and the pulse volume will be more. Typical condition which causes Pulsus paradoxus is cardiac tamponade. But that is not the most common condition. Most common condition is chronic obstructive airway disease, where the swing in arterial pressure is due to the wide swings in intrathoracic pressure. Rarely, Pulsus paradoxus may be noted in constrictive pericarditis and restrictive cardiomyopathy as well. This is a still image from an echocardiogram showing a large pericardial effusion, typically seen in cardiac tamponade. In the intensive care unit, if the person is on invasive intra-arterial blood pressure monitoring, it is easy to document the inspiratory fall in arterial pressure. There will be respiratory tracing also seen on the monitor. Similar pattern can also be seen in pulse oximetry tracing. Difference in blood pressure between inspiration and expiration is sometimes called as so many millimeters of mercury paradox, like 15 millimeter mercury paradox or 20 millimeter mercury paradox. Clinical documentation is using blood pressure cuff and listening to the Korotkoff sounds. But this is time consuming and should not be attempted in cardiac tamponade, where the priority is to get a pericardial aspiration and relieve the tamponade, which is life-saving. This can be attempted in persons with chronic obstructive airway disease, where it is a chronic situation. You can check for the Pulsus paradoxus measurement and documentation by listening to the Korotkoff sounds. This is documented in normal inspiration and expiration. We should not ask the person to take deep breath. Cuff pressure is elevated above the presumed systolic pressure and we listen to the Korotkoff sounds. Initially, we will hear Korotkoff sounds in expiration only with a gap in between during inspiration. And as the cuff pressure is lowered further, it will be heard in both